failure to negotiate and conclude on our CBA, this collective bargaining agreement. Number 2 is failure to provide and is failure to implement 2017 return to work agreement. Number 3 is failure to employ our UHC nurses into PNP terms. Number 4 is failure to implement our nursing career progression guideline by the COG. So these issues that have gone through are addressed to COG and SRC and MOH. They are not addressed to respective Machakos County government, because we have been having negotiation with COG, but apparently the COG have refused to sign our CBA. So we have decided to go on strike so that we can force the COG and MOH to sign our CBA. We have also implementation of our 2017 return to work agreement. This one was signed in 2017, but apparently the COG and COG, MOH and SRC have not yet implemented. So we think that we feel that the hindrance.
What we realizing is that we are dealing with a problem that the COG, that is Council of Governors, the SRC, Salaries and Remuneration Commission, and also MOH are hyping to counties. And the problem now we are having is that you realize that we've been able to have agreements from the county level that even the county is willing to implement. And I'll give you a very good example. In our CBA that we are asking for, we are finding that already the county government of Machakos, for example, sets a budget. They want to implement this CBA. But then their hands are tied as the individual employers, now the county government. And a very good example is the risk allowance, which Our Excellence here set the budget for it. But then implementing it in the payroll of these nurses becomes a challenge because COG becomes an hindrance. So that's why we are taking the war to where it deserves. We've realized as unions that our problem is not at the county level. The problem we are having is at the COG, because COG has become a body that seems to be directing the governors on what to do. So that is why we are moving now to the national level. So this fight, we want to retaliate that it is not a county problem. To unblock all these obstacles they are putting on the way, let them exit our CBA, let them sign. CBAs cannot be signed at the county level. CBAs, this COG, we had started negotiation at the county level. They say that let all negotiations of CBAs be done centrally. And then now they run away from the CBA. We are going to Delta House. That is where we are marching with these with members and others who are not here. It's a national strike. SRC refused to allow to allow a PPD, that is the Department of Public Service, codes to allow entry of the risk allowance in our pay slips. So these problems are not count issues. They are national. They need a national attention. If they keep on pushing us, we are going even to mobilize our members and ask for a referendum to revert back to the national government. We are tired. We cannot be having a situation where individual counties are willing to implement matters, but then now the COG becomes a problem, a stumbling block. We are done. Nurses are the only cadre in health that do not have a career progression guideline. Why? We had a very career progression guideline that was accepted and even approved by the Public Service Commission and forwarded to the counties for customization and adoption. What happened? COG again say that we cannot implement this one. Why? Because nurses are so many. Should our numbers be working against us? No.